Hi, good morning. I want to go over the pelvic clock exercise this morning, which is a bit more advanced version of the pelvic tilt exercise, which is, as a quick reminder, pelvic tilt is when we rocking the hips forward and back over the thigh bone to address imbalances, pain, stiffness in the low back, the pelvic floor, and hips. The pelvic clock is more advanced in a sense that we not only rocking the pelvis forward and back, but also side to side and obliquely, and as a more advanced version of it, also able to go clockwise and counterclockwise with the hips, basically becoming slowly belly dancers. But the clock is better, more advanced in the sense that it can also address imbalances in the pelvis, meaning it happens a lot that when someone sits a lot and they cross usually one leg over the other, or when they drive a lot, or when they have a sport, when for example golf, it's usually one-sided. Over time the pelvis will either tilt forward or back on one side, but it can also rotate one side over the other. And with the pelvic clock exercise, we are able to address these imbalances slowly but surely. So super important exercise. I hope you're able to stay with it and master it, even though it may seem boring. The exercise itself is simple. We lie down on the mat face up, heels in line with the sit bones, knees in line with the hips, and the movement only happens in the hip area. Upper body is stable, legs are stable, and as a reminder, the tilt is rocking the pelvis forward and back. So if your pubic bone was 6 o'clock, your belly button 12 o'clock, you would go from 6 o'clock to 12 o'clock. With the pelvic clock, your right hip is 3 o'clock, left hip is, no, the other way. Right hip is 9 o'clock, left hip is 3 o'clock. So we're also going from 3 o'clock to 9 o'clock, rocking the pelvis side to side. More advanced variation would be going from 4 o'clock to 10 o'clock, or from 7 o'clock to 1 o'clock. Whichever you basically, the time doesn't matter. Basically mobilize your low back and pelvis, rock the pelvis forward and back and in circular motion, where you feel any kind of stiffness, any kind of pain, any kind of fascial adhesion. And the exercise it's a gentle exercise. Always let pain be your guide. But if you, for example, feel that there is some stiffness on your right side because you're right-handed, right hand dominant, right leg dominant, usually the psoas on that side tends to be shorter, or if you cross your leg always on your right side tend to be tighter. So stay in that area and then mobilize your hip joint, mobilize your low back vertebrae out. There's no secret to the exercise. The only secret is to be able to come down to the mat and stay down and be able to mobilize the tissue out. Again, addressing low back pain because we are mobilizing the lumbar vertebrae. Addressing hip pain and pelvic floor issues because this is where the hip muscles attach, this is where the external internal rotators attach, and those are the ones that usually get tight or weak from repetitive movements or one-sided movements or from being inactive from sitting. some of the pelvic floor muscles attached to the hip bone. So by rocking the pelvis side to side, rocking it forward and back, we are able to address pelvic floor issues, which is important. And I think that's it. I think I said it all. If you have any questions, please leave it in the comments or send me an email. I'm happy to address them. And I hope you're able to master the exercise. I hope you're able to mobilize your pelvis and low back and overcome your pain. Thank you. Have a good day.